The breast program at St. Vincent's Medical Center has initiated the use of a cutting-edge nerve block technique to provide superior pain relief after a patient undergoes breast surgery. Here today to talk about the nerve block program is Dr. Teresa Bowling, the Director of Anesthesia at the Connecticut Orthopedic Institute. Doctor, welcome.
Good morning.
So anesthesiologists at St. Vincent's have developed an innovative and unique protocol for patients who are undergoing breast cancer surgery. It reduces the need for narcotics for pain. How is that possible?
Well, we use a specialized technique here that's unique to St. Vincent's, where we incorporate a series of 3 nerve blocks to eliminate or decrease the amount of pain that a patient experiences after major breast surgery. It actually numbs up the entire chest and abdominal wall.
How is a nerve block performed?
Our patients are met by an anesthesiologist with specialty training in nerve block techniques. We give our patients intravenous sedation that makes them very comfortable, during which we give the nerve blocks before the operation starts. The sedative actually offers some amnesia, so the patients often don't remember having the blocks at all, and it certainly is not painful. The advantage of giving the blocks before the operation is the patient needs very little anesthesia during the operation and wakes up fairly quickly in the recovery room.
Interesting. And speaking of recovery, tell us more about the recovery for these patients using this nerve block.
It's like night and day from the patient's experience prior to the protocol. Patients are awake in the recovery room almost immediately upon their arrival after often what is a 6 or 7 hour complicated surgery. We've seen a 4-fold decrease in nausea in the recovery room because we are decreasing the amount of opioids by almost 75% that our patients need in the entire perioperative period.
All right, we understand that your findings were so significant that you and your team published the results. Tell us about that. You must be so proud.
It was clearly obvious very early on that we had made a big impact in patients' pain management after breast surgery. So our in-house research team started looking at the data, and we saw this decrease in 75% in opioid requirements up to 48 hours because the medicine lasts for up to 2 days. And with that, we saw all the decreased side effects related to opioids like nausea and vomiting, sedation, things that are very unpleasant for patients. So we're excited that our paper was accepted to the second largest anesthesia meeting next month in New York City because the research is really groundbreaking. It will change the paradigm for pain management for patients undergoing breast surgery.
Amazing. All right, quick last question. Tell our viewers about other benefits from nerve blocks.
We're seeing a decrease in length of stay. This procedure was historically a 4 to 5 day admission, and now it's under 2 days. And in select patients, we're looking at next year letting them go home the day after surgery because they don't need to be in the hospital for pain management with heavy-duty intravenous opioids. Another major advantage is a decrease in the risk of opioid addiction, which is a real problem in our country.
All right, Dr. Teresa Bowling with St. Vincent's Medical Center, thank you so much. Great work.
Thanks so much.